Asking as someone with no clinical background, can you please explain the difference between the two treatments in this study?
Yes, of course. So I'm an interventional cardiologist. So let me explain about the interventional cardiology procedure, which is stenting, or what we sometimes call PCI. And then Mario Gaudino, my colleague, will then explain to you about bypass surgery. So in a stent procedure, you can think of it a little bit like plumbing. Okay. The heart is a muscle that's beating and contracting on every beat. And it has these arteries that are on the surface of the muscle that brings the blood and the oxygen and the nutrients to the heart muscle itself. And sometimes, just like your plumbing, those tubes or those arteries get clogged. And I'll give you the overall picture. There's two ways to fix that problem. One is by plugging in a tube before the blockage and then plug it in after the blockage. That's bypass surgery. Another way is to go in with a Roto-Rooter and try to clean the blockage out on the inside with a variety of different techniques, either balloons or what usually is a stent. And a stent is a little metal cage that holds the artery open from the inside out. And there's hundreds of thousands of these that are done every single year. So during the stent procedure, the interventional cardiologist will give you a little bit of local anesthesia. It's usually from the wrist, but it's sometimes done from the artery in the groin, in the leg. And it's pretty painless. It's a little tiny pinprick. You may be given some mild sedation, but you're awake during the whole procedure. And then they thread catheters, which are like hollow tubes, up into the arteries of the heart. So from the wrist or from the artery down in the leg up to the artery of the heart. You don't feel any of that. And then they pass a small wire past the blockage. They use a balloon to open the blockage, and then they put a stent in to hold the blockage open. So the nice thing about the stent procedure is that while all procedures, whenever anybody does anything inside your body, can have complications, it's usually a relatively painless procedure. It usually lasts somewhere between 60 minutes, can be 2 to 2.5 hours in complicated cases. And you will often go home the same day or the next day. Now, the recovery in the short phase, one of the nicer things about stent procedures is it's usually relatively straightforward. You may be asked not to ambulate very much, that is, walk for the first day or two, just to let the vessel heal, particularly if it was a vessel in the leg. You'll have a bandage if it was a vessel on the wrist for a couple days. And then you'll get back to your activities of daily life, however you spend your days. The problem is that what can happen after stents is that you can get recurrences. And scar tissue can form at the sites of the stent, and that can re-narrow the stent, and sometimes blood clots can form. So it can actually cause a recurrence of your symptoms, and you may need additional procedures, either another stent procedure or even sometimes surgery if it comes back severely. If a blood clot forms, that could actually lead to a heart attack. So there are procedural risks of the original stent procedure. And, every possible with any procedures, like I said, whenever anything is done inside your body, whether it's stents or surgery, everything possibly that can go wrong has gone wrong in some people, up to and including people dying. But those complications are very rare, but it's not zero. And then there are long-term complications that can occur. The stent procedure tends to have a relatively low frequency of early complications, but it tends to have a somewhat increased incidence of late complications. So let me now pass this over to Dr. Gaudino, and he'll describe bypass surgery.
Thank you, Greg. And I think, surgery is the other way around. Surgery, as all surgical operation, is not something that you can go on the same day. You generally spend in the hospital at least 5 days. You cannot go back to work after a couple of days after PCI. It will take several weeks for you to be back to baseline and be able to go back to work or to your everyday activities. The risk of something going wrong, even though it's a very safe operation, is still a major operation. So the early risk, the risk immediately after the operation, is higher than the risk of stenting. But the good part about surgery is that generally you are one and done, at least for the first several years. And that if everything's go well, your risk of having additional procedure in the years after the intervention is not very high. Doesn't mean it's zero. There will be some patient who will need other intervention, especially after several years. But generally speaking, that risk is lower than compared with stent. So I think to oversimplify with stent, you pay a smaller price at the beginning, but then your potential need for other procedure is a little bit higher. And with surgery, it's the other way around. Surgery, you pay a higher price at the beginning, but then the price you have to pay in the following year is probably lower. So the two in the end seems to balance themselves.
And, Mario, I would also add, this is really what we know from performing hundreds of thousands of stents and surgical procedures and all of the data that we see from the randomized trials, but that's mostly in white men. So, for example, we know that women have smaller arteries than men in general, and that makes it harder to do both stents and surgery. And we know that people have different priorities, women compared to men, and patients who are Black and or Hispanic patients. And we don't know which is better or if the risk-benefit ratio is exactly as we've described in white patients, which we think we understand pretty well, compared to a patient such as yourself. So that's why we're doing Recharge. And, also importantly, as we'll mention again and again, you have extensive coronary artery disease. And the general gold standard treatment for extensive coronary artery disease has been bypass surgery. And bypass surgery has been around longer than stenting, but stenting is getting better and better and better. And we believe that for a person such as yourself, if your physicians agree after talking to you and looking at your particular clinical condition and looking at the blockages in the arteries of your heart, that perhaps stenting is as good, maybe even better. But we won't know until we do a trial such as this. But again, surgery is what most people would consider to be the gold standard. And then the very last thing I'll say is that, we'll be following you closely in this study for up to 10 years. And over a 10-year period, people who have extensive coronary disease often end up needing multiple procedures. Sometimes it's multiple stent procedures, rarely multiple surgical procedures. Often it's a mixture of both. So sometimes you'll have a stent followed by surgery. Sometimes you'll have surgery followed by a stent. They might be 6 or 7 years apart. We don't know. So all we're trying to decide in the Recharge trial is which procedure should be done first to give you the best chance of living a long and very high quality, happy life.
And Greg, this is a very important point that we have described how the intervention work, but this is based on what we have learned in white men. And we really have a very limited understanding of the way the two of them compare in women, Black and Hispanic patients. That's why we're doing this trial. And that's why we believe if you are a Black or Hispanic person or a woman with extensive coronary disease, you should consider joining this trial.